According to the American Heart Association, more than 5 million people in the United States are diagnosed with heart valve disease every year. Heart Month is an important time of the year to highlight heart valve disease symptoms and new treatment options that are available for patients. The St. Luke's Valve and Structural Heart Center has been on the front lines of advances in treatment for various heart valve disease conditions, producing positive long-term outcomes. With us today is Dr. Elizabeth Greer, a structural interventional cardiologist at St. Luke's Mid-America Heart Institute. Dr. Greer, thanks for joining us during Heart Month. We appreciate it.
Thanks for inviting me.
So I want to start with heart valve disease affecting certain patient populations. Who do you traditionally see with these diagnoses?
Yeah, so often valve disease is a disease of aging. So it develops over potentially decades, and you can get deterioration of the valve. So a lot of our patients are over the age of 65. That being said, there's other heart conditions that can cause valve disease. So things like coronary disease, heart failure, rhythm disorders. On the other side of things, I see a lot of patients who have what we call congenital heart disease, meaning that they were born with heart defects. And so a lot of times in childhood, they've had potentially multiple surgeries for their valves, and those will start to break down over time. And so they need repeat valve procedures too. And so really both of these patient populations can be good candidates for what we call percutaneous interventions, meaning less invasive, usually through the leg approaches for valve repair or replacement.
Appreciate you explaining that. Research is a major component of the work you and your team do. What can you tell us about clinical trials that St. Luke's is currently enrolling in?
Yeah, so it's exciting because the clinical trials really put us on the forefront of the new technology that exists in the valvular heart disease space, both for valve repairs and replacement. And so right now we're enrolling in several clinical trials and early feasibility studies looking at the effectiveness of some of these devices, in particular for mitral and tricuspid valve, which traditionally can be a little bit more challenging to treat. And so it's great for a lot of patients who aren't good candidates either for more traditional open heart surgery or for what we commercially have available right now in the percutaneous space. And so it's an exciting time because it's really allowing us to broaden the spectrum of what we can offer our patients.
You mentioned the tricuspid valve, and I want to follow up on that. Can you tell us what that valve does and what tricuspid regurgitation is?
Yep. So the tricuspid valve is on the right side of the heart. The primary goal is to direct blood from the right atrium to the right ventricle, which is the pumping chamber on the right side of the heart that pumps blood into the lungs where it gets oxygenated and then goes to the rest of the body. And so typically when we're talking about valve disease and the tricuspid valve, it's what we call regurgitation, as you mentioned, which is a way of saying a leaky valve. So that when the heart muscle squeezes, rather than all of that blood going to the lungs, a lot of it goes backwards to the veins. And so what that means is that you can get fluid retention, and a lot of times patients have symptoms like fatigue, shortness of breath, just not able to do the things that they want to do.
And so this diagnosis has two new treatments that St. Luke's offers. Can you not only tell us what those are? I know you brought a piece of equipment to show us what it looks like.
Yeah. So the first is what we call a transcatheter tricuspid edge-to-edge repair, or TTER for short. And what that is a procedure where we repair the valve by kind of grabbing the two parts of the valve that aren't coming together very well and sort of cinch them back down. And so we use this device called the TriClip. This is a real example of what one of these might look like.
Wow.
And so it looks sort of like a clothespin, and you grab the two parts, cinch them up, and then close the device. And it really does a great job of reducing the amount of blood that goes backwards and translates to more blood going forward.
Sure.
Now, there are some patients who anatomically might not be good candidates for this.
Yeah.
So we also have a new treatment option called the Evoke valve, which is a valve replacement option. And it uses this really kind of unique anchoring system where it anchors onto the current valve, holds it in place, and then redirects blood flow in the appropriate fashion through the heart. And what's great about both of these procedures is that they're minimally invasive, done through essentially a big IV in one of the veins in the leg. And so that means recovery is relatively easy for our patients, and most of them actually go home the next day.
That's fantastic. How about the other heart valves and the repairs and replacement procedures that are available?
Yeah, so for the mitral valve, we have similar technology as the tricuspid clip that I showed you. And then on the aortic side, that really was the game changer and what started the whole structural heart space. So the first transcatheter aortic valve replacement, or TAVR procedure in the US was done over 20 years ago. And so this technology has been around for a long time and has kind of been perfected with multiple iterations. And so we do hundreds of those valve procedures a year. Wow. And what really sets the Mid-America Heart Institute apart is that we have unique training and a specialized skill set to be able to treat the most complex patients. So, for example, patients who maybe have a prior surgical valve who have a prior catheter valve and need that valve replaced. We have a lot of experience in putting catheter valves inside prior surgical or transcatheter valves. Yeah. And that really, there's a lot of nuance and complexity with those cases. And so we've been able to offer some of these, more challenging cases and be able to treat patients who otherwise might not have been considered good candidates for these procedures.
I love everything that you've shared so far, Dr. Greer. And as we wrap up and continue to recognize Heart Month, what are some final thoughts you have for our audience?
So I think similar to a lot of heart disease, it's so important to do early screening and early detection. Mm-hmm. And so we really want to empower our patients and their care teams to identify symptoms and risk factors for valve disease. Because really our primary aim is to try to detect valve disease early, because if you don't, and it's sort of further along the spectrum before it's diagnosed and treated, then you can get things like heart failure and other complications that can be more challenging to manage in the long term. And so it's a really exciting time to be in this space because we have so much new technology, and it seems like every month there's something new that we're able to offer our patients. And so it's exciting to think of where we might be another 5-10 years from now in the percutaneous valve space.
Well, we appreciate the great work you and your team are doing, Dr. Greer. Thank you again for joining us. We appreciate it.
Glad to be here.
To learn more about St. Luke's Valve and Structural Heart programs, you can visit stlukeskc.org/valve. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.